Recent research underscores the escalating threat posed by zoonotic infectious diseases. With increasing human-animal environment interaction, the risk of outbreaks heightens. Uganda, having weathered Ebola and currently grappling with cholera and anthrax, serves as a stark reminder. Every nation faces vulnerability to outbreaks, and Uganda has prioritized preparedness against a spectrum of diseases including anthrax, zoonotic influenza, viral hemorrhagic fevers, brucellosis, African sleeping sickness, plague, and rabies. Amidst current outbreaks of anthrax and rabies, Uganda, alongside partners, is intensifying efforts in prevention, early detection, and swift response. Crucially, support from USAID has been instrumental in these endeavors.
Looking at the recent outbreaks that we had, Ebola, anthrax, we have the internal capacity in Uganda to be able to, one, at a national level to be able to respond without necessarily calling on support of the experts. I would say in the recent Ebola outbreak, it was largely controlled by the experts that has been developed over years in Uganda. So one is, I would say, the capacity to diagnose, but also over time we used to have outbreaks where in terms of the response, people would come from a national level, from Kampala, to come like down here in Mbale to be able to respond to outbreaks like the existing one, cholera or anthrax. But currently I can confidently say that capacity has not only been built at a national level, but also at district level for the districts to be able to control some of these outbreaks. It's only at an expanded outbreak that requires a national level support. And this capacity, yes, has been is attributed to USAID efforts, but also the collective effort of other stakeholders.
Central to this initiative is the training of communicators and healthcare workers to effectively address the threat of these infections.
Health workers have also trained those VHTs, the LC1s, on how to send a message on any disease they come across in their community.
And actually through training of the district teams in reporting during COVID-19, we were able to improve reporting from 42% at baseline to 93%. And this was really due to our EOC efforts.
We are currently training the journalists as part of enhancing the voices of the community as a means of prepositioning the capacity at a community level.
As a journalist, we tend to leave out some of the diseases that are in our communities without knowing that these diseases affect human and animals. Now, with One Health here, I've learned that there are a number of diseases that affect animals and humans. So a take home here is I am going to inform my community about how these diseases come about and how can we prevent them and how to detect them.
However, challenges persist, particularly in districts like Kwen, grappling with an active anthrax outbreak. Here, there is a call for increased government support to contain the spread.
We need to have a One Health team in place where we are working with the wildlife. We're also working with people of the environment, and then health, and then vet. So that even if the environmental people are able to pick samples and check on the contamination of the environment. And then with regard to how we dispose of dead animals, dead carcasses, so we also need to have a very good plan of disposing them off, disinfect all the places, and also have a lot of sensitizations as well, saying that we are able to cap, if an animal dies, we're able to contain it at that place. bury it safely, disinfect all the place safely, so at least we reduce on the environmental contamination.
This is where the One Health approach becomes pivotal. Beyond disease management, it addresses underlying factors like deforestation, urbanization, and climate change, which fuel emergence and spread of infectious diseases.
It requires a whole of government response. These outbreaks, it's not only a medical issue, but it is a whole of community issue that spans across economic, livelihood, security, because we saw the impact of COVID, how the lockdowns impacted the markets, how it can impact even governance, and therefore I appeal to all stakeholders to ensure that we look at this from a holistic One Health approach that requires all stakeholders to be engaged into this.
By prioritizing prevention, early detection and robust response mechanisms, Uganda strives to safeguard the health and well-being of its populace. Walter Mwesije, NTV.